Good afternoon, everyone. It's really good to be back with you again. It's really hard to believe that fortnight has disappeared so quickly, but there has been an exponential growth of holiday decorations, including in my own home, and of course the new COVID variant in between. So you can really tell that Christmas is right around the corner now. For anyone who doesn't know me, and I recognise there are quite a few additional people here today, I'm Jane Coates and I'm the COVID testing lead for Warwickshire. I'm part of the public health team. My colleague Nadia Ingalls is a consultant in public health, as I've already mentioned if you joined earlier. She's a health protection specialist, and if she's not here just now, she'll be joining us shortly to walk you through the specific updates and changes that are relevant to early years.
She is here.
Perfect, thank you. Welcome, Nadia. So I hope you can see the graphs that I've popped in the chat column. As usual, if you double click on that image, it will expand so that you can have a proper look at the numbers there. I'll start with the grey bar chart as normal, and I hope you can make out that the green bars denote Warwickshire's districts and boroughs, and the table shows us the most recent data on case numbers across the county. At the moment, Stratford is at the top of our areas at around 503 cases per 100k of population over a rolling 7-day period. North Warwickshire is the next of our districts and boroughs at around 434, Nuneaton and Bedworth at around 403, Warwick at around 361, and Rugby right down in fifth place for Warwickshire with 341. If you're a regular attendee at these meetings, you'll know that these rates are very changeable and we see quite a lot of ups and downs. The rates for Warwickshire as a whole county is currently 408.5 cases per 100k of rolling population over the 7-day period. This puts us just inside the top third of West Midlands counties, with Telford and Wrekin currently topping the table, and they've got 541 cases per 100k at the moment. So you can see the difference in numbers. They're really quite some way ahead at the moment. One interesting factor about the pattern of cases in recent weeks is a suggestion that more affluent areas are starting to see case rate increases, with our more deprived areas appearing much lower in the rankings. There could be any number of reasons for this, in all honesty, including how far the virus may have previously spread in those communities and the degree to which there's some natural immunity if many people have already had COVID. It's really difficult to be definitive about these things because the landscape is so changeable. The second graphic is one that I know Nadia likes and uses a lot, so I've included it here today. The green shaded lines show the pattern of cases by district and borough, and it's the period between the middle of August and now where we are just at the end of November. So you can really see the peaks and troughs. But thankfully, if you go to the right side of that graph, the lines are tipping downwards, which of course is a pattern we hope continues. In conversation with your early years advisory team this morning, I understand that some of you are experiencing increasing numbers of positive cases just now. Those settings with a more regular experience of dealing with positive cases will be old hands at knowing exactly how to respond. But for those of you with infrequent experiences, it might help to just go over a few headlines to help you get to grips with what you need to do. The first reminder is to make sure you're receiving the regular briefing emails from the early years advisory team, which are full of really useful information and signposting. The team is on hand Monday to Friday and is only too pleased to help you. So do contact them through the team inbox with any questions that you might have. At weekends, you can always contact the Public Health Duty Desk if you've got emergency issues which you really need to flag with somebody outside normal office hours. The team is accessible by email, and I'll put the email address in the chat column once I've finished speaking and Nadia's talking. But you probably have used it before. It's dphadmin@warwickshire.gov.uk. The second reminder is to have to hand your risk assessments and outbreak management plans and to refer to them as and when you need to. The pandemic inevitably is a changeable beast, so your plans will need to be amended so that you can adapt to whatever is going on at the current time. But don't forget that you've already done some of the legwork much earlier in the pandemic to help you cope with cases and outbreaks. It's quite easy, I think, to forget something that you did a few months ago in the flurry of activity, but do dig them out and have them close by, just in case you need them. The third reminder is around the importance of ventilation, particularly as the weather gets colder and the temptation to close all your windows grows. Ventilation is your friend, and even though it might not feel like it on cold days, extra layers are the way to go, and I know that Nadia will say more about ventilation in a moment. The final reminder from me is to continue to promote twice weekly lateral flow testing. This is a really good way of continuing to pick up those cases without symptoms. Lateral flow test kits are still available at many pharmacies for free, as well as a range of community locations right across the county. In fact, we have 30 locations, many of them county council libraries where kits are available for free, so do please call in during normal opening hours. Given how much information is being pushed out by the media at the moment in light of the emergence of the new variant of concern, Nadia is now going to spend some time reiterating key messages to help you stay on top of them, and she'll also pick up any specific queries you might have. As always, use the chat column to note any questions you've got, and we'll do the best we can to answer them today. So on that note, over to you, Nadia.
Thanks very much, Jane, and it's nice to be here. I know it's been a while since I've been. I'd like to introduce a colleague, if you haven't been introduced to her before, Michelle Wykes. I don't know if you want to give a wave, Michelle. Michelle works with us in the COVID Prevent and Response team. Are you there? Can't see you. Prevent and Response team with us, and whilst I know Fidelia would usually attend these meetings going forward, unfortunately Fidelia will be leaving us in December. Michelle will be here, but will be here with us and be working with the early years team as well as the schools team as well going forward. So I just wanted to introduce Michelle. I'm not sure if I can see. I'm spotlighted apparently. My video is highlighted for everyone in the meeting. I'm sorry about that. So hopefully Michelle's given you a wave. A few things I just wanted to talk about. So just in terms of how we're managing COVID now, we're managing COVID exactly the same way as we have done since the beginning of September, really. So if you can still refer to the little PowerPoint presentation slide. Oh, there's Michelle waving. That's good. Little PowerPoint presentation slide that has got the key pathway on it for you. That all still stands, and I'll talk about Omicron in a little while. But I did want to just clarify a few things. So it's really important that anybody who's got any of the COVID symptoms, they don't have to have all of them, just any one of the COVID symptoms, that's a new continuous cough. And it's really difficult sometimes to judge whether something is a new continuous cough. So just a cough, a high temperature, or a loss or change in taste or smell, any of those, and we'd say what we want to do is rule COVID out. We know that there are other things that are circulating, but any of those symptoms, no matter how mild, we would ask them to isolate and to book a PCR test. Now, you may have some parents that don't wish to PCR test their children, but if you're completely within your rights to say, if you're not going to, we would prefer you to not come into the setting because of the potential risk to others. So if you don't have a PCR result for a symptomatic child, then the pathway will say to ask them to isolate for 10 days. At the end of that 10-day period, assuming that they're well, that they should be able to come back again. But I just say that, for staff and children, anyone with any of those symptoms, they should isolate and book a PCR test. That's the main message. If they don't want to, then we do ask them to isolate for 10 days, but then to come back again after that, even if they haven't had a PCR test. I hope that makes sense. And it is important that they isolate whilst they're waiting for that PCR result as well, because they should be. That is part of the legal obligation. Obviously, anybody who's positive as well must absolutely isolate for a full 10 days. In terms of close contacts, the important thing is with close contacts is firstly identifying them, and again the chart goes through identifying them. We go 2 clear days before the day on which the individual develops symptoms through to 10 days after. That's the infectious period. And close contact can be very, very fleeting. It's any face-to-face contact for any duration, under 1 metre for 1 minute or more, 1 to 2 metres for 15 minutes or more, or travel in a vehicle together. So anybody who's had close contact with that individual who's positive in the infectious period is a close contact. Now, for children under 18 years and 6 months, or adults who are fully vaccinated, so they need to have had at least 2 doses of the vaccine more than 14 days ago for their second dose, they don't need to isolate, but we do suggest that we recommend a PCR test for them and for them to continue with LFT testing. Now, this is assuming that these close contacts don't have symptoms, because if they do have symptoms, then you treat them as though they're a potential COVID case, etc. So if these close contacts don't have symptoms, you identify who they are. Those that are under 18 years and 6 months don't need to isolate, and those who are fully vaccinated don't need to isolate, but we do ask them to have a PCR test and to continue with lateral flow testing. You'll see in the national guidance that it says that close contacts who are under 5 may not be asked to have a PCR test unless they're a household contact, but this is our local guidance, because we do find that actually PCR testing identifies additional positives, so you can make sure they're isolating, and it starts to reduce the spread in your setting. So that's why we ask for PCR testing of close contacts. We can't mandate the PCR testing of close contacts, but we certainly highly recommend it. And the same with LFT testing. You can LFT test as long as the parent is comfortable to do it, and they feel confident and they're not going to hurt the child, etc., to do regular LFT testing on their children. Some parents won't want to do it, and that's absolutely fine, but we are promoting testing locally. So that's what you do with symptomatic people and those who are close contacts. Just to say that those close contacts that are not fully vaccinated and over 18 years and 6 months, they do legally need to isolate for 10 whole days after the day they last had contact with a case. So I hope this makes sense. It's quite difficult when you're saying it out loud, but it is all in that flow chart on the PowerPoint slide that you should have as well. So we're not stopping any of that at all for Omicron. That's exactly the same, but I will come on to Omicron in a minute. In terms of some top tips for outbreaks, and I know a lot of you will be experts in this yourselves, and you'll have seen what has worked and what hasn't worked, but we try to, certainly in an outbreak situation, look at how much mixing is going on. Can you do anything to reduce the mixing of your staff and the mixing of your children? So, keeping to stricter bubbles where you can for the children. Thinking through how staff mix and any cross cover that they might do at lunch times or break times. Can you stop that kind of cross cover? It is quite difficult. Can you send staff for breaks on their own, or certainly if there is a staff room, to make sure that they keep distanced? Those are the sorts of things that we talk to settings about. The other thing that we have seen previously is managers of settings greeting every child as they come in through the door. Which is really nice, but we have, if that manager's then positive, you then end up potentially with a risk then to multiple children. So we ask, actually, could the staff that are looking after the particular bubbles go and answer the door? So that's all about sort of staff mixing. Really good hand hygiene and cleaning absolutely goes without saying. Testing we've already talked about. Testing, tracing and isolating, really, really important as well. Vaccinations. Obviously, please do keep pushing COVID vaccinations for all your staff. You'll have heard the announcement linked to the Omicron variant being discovered that boosters will become available for everyone aged 18 and over, but they'll come down the age groups and make people eligible at different times just to stagger it a little bit. So everybody over the age of 18 will be eligible for a booster. 12 to 15-year-olds will be eligible for a second dose 12 weeks after their first dose as well. So you've seen that. So please do urge staff to get vaccinated. including against seasonal flu if they're in an eligible group for seasonal flu, because the last thing you want is flu circulating as well as COVID. So we definitely say that. And ventilation is really important, and keeping windows ajar. We know it can get cold. If you do have to have windows shut, could you open them for 10-15 minutes every hour? Could you, there are different ways in which you can kind of manage that ventilation to try and reduce that overall risk, and it really does reduce overall risk in your setting. In terms of Christmas plans for nativities and shows and things, what we're saying at the moment, which is exactly the same message that we're giving to schools, is that just risk assess it. Some settings will want to do things virtually, and that's absolutely fine. In some cases where you've got big outbreaks, we might actually advise you to do things virtually and to not do things face to face. But if you've got a few, if you don't have any cases in your setting, or just a few cases in your setting, you might choose to do face to face shows or nativities, and that is fine as long as you risk assess. Think about who you're bringing onto site, how many people you're bringing onto site. Could you reduce that number or do it in phases or year groups? How can you keep different families apart, or try and reduce the mixing as much as possible? Ask people to wear face coverings when they're circulating and coming into the setting, and asking them to do a lateral flow before they come into the setting as well. Think about ventilation, all those things that we've talked about that you would be thinking about for your setting anyway. It's exactly the same kind of risk assessment you'd be thinking through if you are going to do something face to face. So we're not saying to cancel everything, we're just saying, think about your cases. If you've got a lot of cases, we may well advise you to do something different. You might choose to do things virtually, or you might want to do it face to face, but just think about the risks, and what you might do if somebody told you that they were positive the next day. How would you trace close contacts, or would you have a way of alerting people who'd been in the setting, just to make sure that they were aware. And then finally, on Omicron. So Omicron, in many ways, at the moment, doesn't change all of these principles we've discussed. It doesn't change the outbreak management that we have shared with you since September. Do keep just doing what you're doing. The few things that it does change, obviously face coverings are now being recommended. I won't go as far as mandatory. I don't know. So colleagues from earlier years might want to challenge me on that, but it's certainly in the DFE guidance that all staff who in areas where there's in communal areas from early years right through to senior schools should be wearing face coverings. So it's something for you to think about for your setting. Obviously, anybody that returns to the UK from any of the red list countries, I believe there are 10 countries now, but that list will grow. Anybody who returns to the UK now will go to a quarantine hotel where they will have to see out their 10-day isolation and day 2 and day 8 tests. Anybody not coming back from a red list country is asked to isolate and do a day 2 PCR test. The guidance does say on or before day 2, but a day 2 PCR test, and they have to isolate until they get that PCR test back. So that's just something to think about, if staff are going on holidays, that they will be subject to those rules as well. And importantly, because we're having quite a few emails in about this, even if you've tested positive in the last 90 days, you'll recall that if you've tested positive in the last 90 days, we say you don't have to test again unless you develop symptoms or you're otherwise advised that you need to get a test. But if you haven't got symptoms, you tested positive in the last 90 days, we usually say don't get another test. But for travel, it's going to become, you need to do PCR tests for travel, and that really is something that is linked with Omicron as well, because obviously we'll have seen people that have been infected with previous variants, and they may well get infected again with this new variant. So that it's really important to do those PCR tests on return from travel. and is required. So but in terms of how, there was a question that was sent in, how would we know if we had an Omicron case? Don't worry, we will be all over it, and I say we, public health, we'll be telling you hopefully before. So obviously there is a little bit of a delay whilst they do the genetic sequencing to look at, because with the PCR tests, so the labs that the tests that go off to the lab, they essentially look at the genetic material in the virus, and they need to do what's called sequencing just to see, is this the Omicron variant or is it another variant, and that may take a little bit of time, although we do get some early warning signals quite early that we think something is might be Omicron, just from some of the early testing that they do on the virus, plus knowing about travel history. Together we can get an early indication of, do we think this might be Omicron, in which case we'll be in contact with you, and you'll have seen that obviously any Omicron case, as with any positive case, needs to isolate for 10 days, but all of their close contacts need to isolate for 10 days, irrespective of vaccination status, irrespective of age. So we will absolutely be supporting you through that. In terms of advice, it might get a little bit tricky if we start get Omicron and Delta circulating at the same time, because you've got two different rules, but we'll work that through with you. So please don't worry about that bit, because just keep going with what you're doing already, because everything that works for Delta will work for Omicron as well, in terms of those measures that you're all putting in. So I'm aware I've been talking for a long time. I'm hoping that's not too long, colleagues, and there might well be some, and I don't know if that was helpful.
We've got a couple of questions in the chat. So Michelle's just answered one about a child where parents aren't very willing to cooperate. When the child is sent home with a temperature, if once the temperature has gone down and then doesn't rise again, e.g. a one-off, is this still requiring a PCR?
This is where it gets really tricky, and what have you said, Michelle, so that I don't hang on, because sometimes we have to have a debate amongst ourselves.
We do. And basically it's a symptom of COVID-19, so we'd ask for them to go and get a PCR and return once it's negative, and if they choose not to, then isolate for 10 days.
Yeah, that's right, and that is the hard and fast rule. I'd just say, if you're having trouble with it, come through to early years, and they can always discuss with us as well, if there's any other circumstances. Please, can we also have the slides? Yes.
Sorry, can I just be specific on which slides it is that people are wanting?
The flow chart that Nadia's referring
to. Yes. So Sonia, it's the main early years flow chart. I think colleagues are wanting to see.
COVID symptoms one and what you do.
Yeah, the little PowerPoint.
Well, rather than send it out to individuals, we'll send it out with a briefing again tomorrow, so that everybody's got it. It's just a little bit easier for us to manage if we do it in a mass mail out rather than individual, if that's okay.
Yeah, that makes sense. That makes sense. Just so you've got it all there. One issue we've encountered is that often a parent will seek medical advice and the GP may say there's no need to test. Oh gosh, that is so tricky, isn't it? And we get that too. I've actually had GPs ask me what the rule is around this as well, and I, because they haven't been clear themselves. So I would say with that one, come through to us and we can try and navigate it, because actually our public health advice is that you do need to test to rule out COVID, and if need be, we can write to the GP and try and explain it. I do recognise it is really tricky when they've had health professional advice like that, and it may well be, and this is the thing, is that a temperature, we know it can be other things, we know that, but what we're trying to do is just rule out COVID because of the significance of it. And many of you will have experienced it when you've seen it go around the setting, and how it can have an impact on staff, and then actually it means you end up not being able to run the setting appropriately, if you've got staff who are ill as well. So yeah, I think you've had that a lot too. Oh, the GP says no need to test. Okay, there's actually something that we need to take away, because I think we need to do some communications to GPs about this, if it's a widespread issue, and we'll take that away actually. They're diagnosed with another illness and then don't consider COVID. Yeah. And that's tricky, because if they are properly diagnosed, you know, they've got a throat swab and it says they've got a bacterial infection or whatever, that's quite different to a child presenting with a viral infection, because although, you know, it's been a long time since I've done any clinical work, I know it's really, really difficult to tell one from the other. You know, it's really difficult because you do tend to hear people saying, oh, I've never had flu because, you know, I've never been in bed for 2 weeks. And that's what flu can do to you when it's really bad. But actually, you can have asymptomatic flu as well. And, you know, back in the pandemic in 2009, there was lots and lots of asymptomatic swine flu. And we know that. So I always sort of question that a little bit. So I will, but we will take that away, because I think there's something we can do. So I'd say the rule is, I mean, it's clear in the government guidance as well, to do that, but I can understand it's frustrating for parents as well. I can understand it if they think it's something else, which it may well be. In which case, you know, if they're unwell, they have their PCR test, it's negative, they're then, you know, fever free for 48 hours, they can come back into the setting, and that's the rule. So
I'm just going to be a little bit contentious here, everybody. You can advise parents to get their children tested, but you can't insist on it, and you can't ask for proof that they've had a PCR test either. Okay, so we just need to bear that in mind. The bit that you can insist on is the isolation. So if you think the child has got symptoms of COVID or they're not well, you can insist that the child doesn't come to the setting. But we have to be very careful that we're not using coercive control.
Yeah, okay. I mean, absolutely. I think you're within the rights to ask for people to share their results with you. But yes,
sorry to disagree with you, but in the government guidance it does say you should not ask for proof of the PCR test. It still actually it tells you to refer back to previous guidance. I did check that, so.
Okay, it would be good for us to take this one offline because it is a contentious one.
Okay. I know it's contentious, but
let's have a look, because certainly we know schools do for sure. You know, they will ask to see. I mean, the reason I'm saying this is actually we have had you know, they don't have to show you. They don't have to show you that, but schools will often ask, you know, please could you share your results with us. But we will pick this up and clarify that point, Sonia, because if it's in the government guidance, we can just look at the nuances around that. And the reason I've said this is that
Jane's given you a message that you've got to go. Sorry to shut you up, Nadia.
Oh yeah, I've got to go to the heads meeting.
You need to go.
Yes.
Thank you very much.
No worries. I'll just say one last thing on that. The reason why it is a contentious issue around this test results is that essentially we have had what people falsifying test results, we think, using, and so and have had to come and check that with us. So I think if we can just clarify that point, that would be great. But yeah.
All right. Okay. Thanks ever so much, Nadia, Jane, and Michelle for joining us.
Thank you, everyone.
Thank you.
Thank you. Thanks all.
Bye.